Hello and welcome to the Majlis, Ready for European Liberties Current Affairs podcast focusing on Central Asia. I'm Mohammed Tahir, the host of the Majlis podcast and Ready for European Liberties media manager here in Washington, D.C. Central Asia is still struggling to cope with the impact of COVID-19 pandemic. One reason why it is the case could be because of the flawed data involving the size and scope of the pandemic in the region. When the data is problematic, every preventive decision that follows leads to more problems, which puts every step that authorities have taken or might be taking going forward into question. So on today's Majlis, I'm joined by Tilak Toktogaziev, a social entrepreneur based in Bishkek, Kyrgyzstan, Gulnara Toraliba, CEO of Data Lab, a consulting company on data, Darkhan Omirbekov, Ready for European Liberties Kazakh Service digital editor in Kazakhstan, and Bruce Pannier, the editor of Ready for European Liberties Central Asia blog, Kishlok Owazi. Thank you, colleagues, for joining us today. So let's start with Kyrgyzstan, maybe Tilak with you. So the question about data. So Kyrgyzstan admitted its first COVID-19 case in March, and today they say there are 40,000 cases, and it appears that there are questions about these numbers. Where do you stand on that?
So now we have a lot of deaths. It's more than, as I know, that it's about 1,500 deaths in Kyrgyzstan, and it's officially. But I think that it's much more because we also a lot of deaths in hospitals. And for example, when we were in regions, in some villages, and we know exactly that, for example, in one village, it was 9 deaths in one hospital. But in official data, they said that it's maybe, for example, like 3-4 deaths in this village. And that's why I think that it's much more deaths in reality. And I think that we should multiply maybe 2 times or 3 times this number to have correct numbers.
You are saying we should multiply twice or 3 times of what the officials are reporting about. I mean, where you come into this conclusion? I mean, yes, you give an example from an hospital, but how widespread is this flaw in data?
You know, some doctors or some people who works in administrations, they afraid of these big numbers from their hospital, and they try to say that the reason of death is not COVID, but it's something another reason.
Okay, let's say that they have reasons why not to come forward and tell the way things are, but how do you know that we should be multiplying this by twice or 3 times?
Because I work with my team in these villages, and we install our oxygen systems in these hospitals, and we know that in one hospital, for example, where we install this oxygen system, we exactly know that there, for example, it was in Jalalabad, we know that there in one day it was 9 deaths. It's 100% it was COVID because it was in red zone.
Right. Okay.
But officially, I don't remember. It was like 3 or 4 deaths in that day.
Okay. Let's bring in Gulnara. You know, your company kind of helps to create a data or consult in creating data. So one question appears to be the way the authorities are counting the COVID-related death. For example, unless the patient is tested positive for COVID-19 and is admitted to the hospital for that reason, the death is not considered COVID-19 related. Is it a factor?
I think that the problem is that we don't have enough testing now. So, and most of the people who don't have symptoms, they are not registered at all, and they treat themselves at home. So, and they're actually not tested and not registered. As for the metrics itself, the problem also was that we had a huge number of people suffering from pneumonia last 2 months. And this metrics also was not counted because it was we didn't have specialists to say whether this was virus-caused pneumonia or it was something different. And having the pressure from the public they combined the metrics only like 3 weeks ago. And when they combined it, we had this the highest number of deaths in 7 days worldwide. Yeah, I think that the message is there that we don't have effective statistics. We don't have quality data.
You heard what we were talking with Tilak, and he's saying like whatever the official number is today, which is 40,000 in terms of the infections in Kyrgyzstan. So he was saying like we should multiply that by twice or 3 times, which means 120,000 cases in Kyrgyzstan. Does it sound like a reliable figure that we should be thinking?
Yeah, as a person working with data, I can't actually say something like this because we work with data we have, and we prefer to rely on official metrics, or if we have an opportunity to collect some different data and compare it, we can do such conclusion. But at this time, we are really have no good access to information and access to metrics, and I can't say that.
So what about this? Like you are saying you are relying only on official data and there is no alternative to official data. So the data you are producing as a lab, how reliable is that?
Yeah, actually, we are now working with the Ministry of Health, trying to teach them or educate them how to collect that data and how to make it public. The problem is that we don't have data specialists in the ministries, and they never worked in such pressure, actually. So, the other problem is that they don't have good communication, and the data also becoming outdated every day. So, and it's a whole bunch of the problems that there is no enough testing. There is no people who can call and say that they're COVID positive if they did their testing themselves, and so on. So in the situation where it's such a lack of data and no capacity to produce them, we are trying to work with what we have.
Okay, let's go to Kazakhstan. I'm sure, Darkhan, you have your points to add into the confusion about the way fatalities are counted. Feel free to add your voice as to how these things are handled in Kazakhstan. Also, I wondered about the data on COVID-19 infections. For example, what's the number today from Kazakhstan? Close to 97,000. Are we sure if that is the real number?
From our perspective, what's happened? The Kyrgyz government is more honest than that of Kazakh government, because they said they would combine the numbers of coronavirus pneumonia with the COVID-19, and they did it in one day. Here in Kazakhstan, there's so many strange things are happening. So, like starting from summer months, Kazakhstan was suffering from pneumonia, and the government was saying that those people tested negative for coronavirus, but all Kazakhstani people knew that it was COVID-19. And there was a pressure from the people, there was an international attention to what's happening in Kazakhstan. Like the Chinese embassy spread just news about unknown pneumonia, and the world community was paying attention to Kazakhstan, and Kazakh government had to say or admit that some part of those pneumonia cases might be COVID-19. And on July 17, our government promised to combine those pneumonia cases that resembled COVID-19 with COVID-19 statistics, but starting from August 1, which was very strange because first time we said okay, because we thought that there were like thousands of pneumonia cases, and we thought the government was trying to calculate, extract all those pneumonia cases that resembled COVID-19 in order to combine with COVID-19 statistics. But later, our health minister said that they're not going to do that. And starting from August 1, we'd be just seeing the pneumonia cases registered from August 1. But again, August 2, we learned that the government was not trying to combine. They just started reporting pneumonia cases that resembled COVID-19 separately, not combining the figures. So for today, we have just under 97,000 officially coronavirus cases, and over 1,000 COVID-19 deaths toll. And there are like 11,000 pneumonia cases only starting from August 1. And we have the statistics. The government provided us with the statistics of pneumonia separately. So from January 1 to August 2, over 256 Kazakh people suffered pneumonia. But the last year, for the same period, there were 76,000 cases. So the number increased by 3.3 times. The government didn't say what percentage of those pneumonia cases are considered to be just coronavirus pneumonia. So here we are with distorted statistics. There is like very, very low trust in the government data in Kazakhstan right now.
I have lots of follow-up questions. Maybe before that, let me bring in Bruce. We had Tahir John Safarov joining us today from our Tajik service, but he could not due to some technical issues. But in his absence, Bruce, earlier our Tajik service, Radio Azadi, they in fact kind of created this conversation in Tajikistan at least with an explosive investigation comparing the actual death and officially reported data. Anything to add from Tajikistan and also from Uzbekistan and Turkmenistan's perspective into this discussion?
Well, it's a mystery how Tajikistan is counting its figures at all. They still have suspiciously low figures for cases and certainly for deaths. And since they pretty much shut down as much independent media as possible, especially after the cases started, it's really difficult to see what's going on there. Uzbekistan, we can see a little bit more, and they've had some of the things they've done I've seen in other countries. For instance, if you're admitted to the hospital and you're not tested for coronavirus, then the chances are if you die, they will find some other reason why you died, a respiratory ailment, heart failure, something like that. But, they justify that by saying we didn't have a chance to test them. It's entirely possible the person had the virus, but that's not what they were admitted to the hospital for. And then, Tilak made a good point that a lot of these hospitals are under a lot of pressure. The governments are telling them, you got to get the cases down. And so they also play into this. And, Pakistan and Turkmenistan, of course, being the worst example where no doctor will say that anyone is dying from coronavirus at all. So they have to come up with some other cause of death when these people die. So, of course, that distorts the numbers too. So it's a combination of a lot of things. And even the pneumonia cases, Turkmenistan, again, looking at them, they'll admit people are dying of pneumonia, but they won't admit that they're dying of coronavirus, of COVID.
Perhaps we will get back to this question. I don't like to cut you, Bruce, here. What does it even change if you report the cause of a certain death, pneumonia, why it matters? Maybe.
It makes no difference at all. But to the government that's trying for some strange reason to convince everybody that they're practically the only country in the world that doesn't have any cases of coronavirus, I don't know why that's important to them.
Yeah.
And I don't know why it's acceptable to say these people died of pneumonia rather than coronavirus to hide the fact that the virus is in the country like it is everywhere else in the world practically.
Yeah, for example, just not Turkmenistan that is doing this. Earlier Tajikistan has been reporting. Now it's become clear COVID cases as pneumonia. And I think until recently, this was the factor in Kyrgyzstan and Kazakhstan. Yeah, maybe we will get into this. Maybe Gulnara can help us to understand the logic behind this. So the thing is, we need to move on. So based on these data, which you guys find questionable, the authorities plan their response. So earlier, Tilak was raising this question. So where they are coming from, how they end up with these data and what kind of flawed consequences they have been leading to. Let's continue the conversation talking about these and many other questions very shortly. But first, let me recap the debate that today on the Majlis podcast, I'm joined by Tilak Toghtugaziyev, a social entrepreneur based in Bishkek, Kyrgyzstan, Gulnara Turaliba, CEO of Data Lab. It's a consulting firm on data, also based in Bishkek, Kyrgyzstan. Darkhan Omirbekov, RFERL's Kazakh service digital editor in Kazakhstan. In Bruce Pannier, the editor of RFERL Central Asia blog, Kishlok Owazi. I'm Mohammed Tahir, host of the Majlis podcast and RFERL's media manager here in Washington, D.C. And we are discussing the source of Central Asia's flawed COVID-19 data and its consequences. So, Tilak, maybe let's get back to the same question that you have earlier raised, how they end up with this data and the logic behind that. You were talking about some hospitals are not providing real number and there are some issues behind that. So tell us what they are doing and why they are doing it.
Yes, I think that it's because of pressure from government, maybe it's because of some fear inside. Maybe they just want to show that in their hospital it's a good situation. And also I figure out that many cases of death. It's because of bad management, in this hospital. So I think that in our Kyrgyzstan, in every hospital, big hospitals, and I can say that it's a big difference. Big difference in management in these hospitals.
Tilak, I don't understand one logic behind here. This thing is not the creation of that specific hospital. Why they have to lower the number? What they lose if they report the way it is?
I don't know. Maybe it's some direction from government. It was because of some panic in regions, and it could be, caused because of maybe elections. So, maybe that on the 4th of October, we will have elections, and they should prepare to these elections. And a lot of election places where we will have elections, they are in these, maybe not hospitals, but some places where we made extra points where our...
Okay, Gulnara, the way Tilak has been explaining this, it looks like totally a politicized situation. Even those doctors also needs to consider the political consequences of what they say and how they say it in terms of reporting about the pandemic, which impacts everybody in the country. You work with those doctors, right? They know what they are doing has consequences, right?
Yes, yeah, absolutely. We had a lot of cases in Kyrgyzstan when doctors were looking for help and they announced it publicly. All those doctors, they put excuses on camera, which was, these excuses were forced by law enforcement, but they don't admit that. But we see in public there are a lot of videos of doctors asking for excuses for such announcements, public announcements. So there is a pressure on doctors, there is a pressure on medical institutions here. So, and the problem is that the way how the government handled the whole situation causes a lot of critical comments and causes a lot of discontent. So that's why they're trying to hide that. But I think that for now they understood that they should work more openly. So it was like some critical situation 2 weeks ago. There was a lot of public discontent on social media. And when we had the situation, when we had the highest rate of deaths worldwide, and it was also exposed in international media, so the government, they started to step back and started to be more open now. And as for data, I'd like to add to Tilak's comments that as we don't have quality data, there are journalists here in Kyrgyzstan started to work with Google requests. So, and they see that the highest number of requests on such equipment in Google, like concentrators, pulse oximeters, the equipment which people need at that time, it was very high. And now it's getting lower. So this is another way we are trying to get some data on the real situation also in Kyrgyzstan. So to look at the requests.
Very interesting. Anything to add, Darkhan and Bruce? We understand politics is a factor. Like in Tajikistan, for instance, they have an election coming up soon. But in Kazakhstan, they don't. Is it even a factor in Kazakhstan, the way things are in Kyrgyzstan?
I'm not sure, but the main point is that we have the regime we inherited from the Soviet Union. So the people who grew up in Soviet Union and who were educated to run the government during the Soviet Union, they're running the government. They're still running our country. And you know that in the Soviet Union, the first reaction to the problem was to hide, not admit, like, you know, what happened to Chernobyl, etc. So our government's first reaction, never admit anything. Like when there is an international conflict between Kazakhs and Uzbeks or between Kazakhs and Tajiks, the first thing our ministers would say, like, no, it's not inter-ethnic conflict, or no, it's not like mass brawl. It's just two people fighting. And the more our government is trying to calm us, the more we become like vigilant. And the second point is that at the very beginning of the pandemic in Kazakhstan, our government was just playing bravado, and they said like, oh, we would devote over $13 billion to fight the coronavirus. Oh, we would pay for medical staff 2 million tenge, which is around $5,000 if they get infected, and 10 million tenge if they die. So 10 million tenge to their relatives, it's around like $20,000. And then the number has grown exponentially, and the number of medical staff infected increased to thousands. The number of doctors who died, there were like hundreds of doctors who died from coronavirus. So admitting the real numbers, it means for government that they have to pay to doctors, they have to pay to the common people. So it's the second implication. The third one, if they say the real number, it would show that they're just failing to fight coronavirus pandemic. And we know that they allocated a lot of money, you know, $13 billion. It's a lot of money for Kazakhstan's economy.
I don't know why those authorities are so sensitive about giving bad news. I mean, everyone is failing. Like the place I'm talking from, the United States, the most powerful country on earth, we are in the middle of mess. So speaking of mess, though, Bruce, earlier this week, I guess you had a story on how Uzbekistan is messing up with this, and Tajikistan surely did, and Turkmenistan, God help us. So, you know, they put themselves into the situation, right? I mean, is it the case now that they can't admit and they are just digging themselves into a situation where they don't know how to get out?
Well, in all these cases, in all across Central Asia, I mean, I wouldn't want to single out those three specifically, but early on, all of them claimed some degree of success in halting the spread of this. You know, I mean, there was lockdowns in Kazakhstan, Tajikistan, or Kyrgyzstan and Uzbekistan. You know, and then the government said, well, it worked. And so we can start easing restrictions. The Uzbek government said that things are getting better. Just a couple of days ago, they said things are getting better and we're thinking about easing restrictions, when in fact the information we're getting from people in the country suggests that the healthcare system is overwhelmed and can't even cope with the problems that they got right now, which we've seen in some of the other countries too. Yeah. You know, I think that plays some role in this, is that all these governments were way too quick to start saying that we got it under control. You know, and of course, again, Turkmenistan's the worst because they say they don't got it at all. Yeah. And, you know, and then just to add to what our other guests have been saying too, you have to remember that at the end of the day, none of these governments are really popular with the people, right? I mean, if there was a fair presidential election tomorrow in all these countries, probably none of these guys would be in office by the end of the week, or by the end of next week, right? You know, that's the kind of situation they find themselves in. If they admit the whole truth, then they have to admit, or at least it's suggested, that they were incapable of dealing with this problem.
Yeah, about this, I know you have some other points to add, Bruce. Let me get in here about this delusion. I don't get this, why pneumonia is taking such a central stage in COVID-19 related discussions in Central Asia. I don't know if this is the case anywhere in the world. Perhaps I don't understand the connection between these two, but feel free to enlighten us on that. And also, Bruce, since the Kyrgyzstan and Kazakhstan have started reporting pneumonia cases along with COVID-19, does this change anything in the equation? I mean, does this make any difference in terms of the confusions that we are talking about that Central Asian authorities are in these days?
I mean, I applaud the authorities in Kyrgyzstan and Kazakhstan for recognizing that the two things are related. Somehow or another, whether you get a little bit of the coronavirus weakens you so that you get pneumonia, but anyway, it's clear that these two things are happening at the same time. and that they're related to one another somehow or another. Whereas the other, Tajikistan, Turkmenistan, and Uzbekistan, for some reason, still seem to try to want to keep these separate, as if there's two different causes for these things. You get infected by pneumonia one way, you get infected by coronavirus a totally different way.
Right.
And we know that's not true anymore. But they stick with that story.
Gulnora, given your background as a specialist in lab testing and all these things, given the fact that the Kyrgyz and Kazakh authorities have decided to report them separately but still report about impact of pneumonia, this decision, does it help us to clear this muddy picture of this confusion over data?
Yeah, very good question. I think that it's not only political reason for that, because, our healthcare system is very bureaucratic. And actually, even if the doctor sees something, there are a lot of clinical protocols they should look for. And there is no science, actually. There is no development of science. And in the country, there is no research centers. So it was like, this outbreak really kept us unaware about the whole situation, because there is no scientists and researchers. So doctors, they just started to study clinical protocols, and they see that this is pneumonia, but they can't really say that this was caused by COVID-19. And so to say that we need this science-based evidence, but there was no science at all. And that's why this whole bureaucratic system made it very difficult to come up with the idea that these statistics should be combined. And it was also some pressure from data advocates in Kyrgyzstan, because we found out that the number of pneumonia is twice higher than it was last July. This kind of study of data started this discussion that it can be twice higher, than like the decade before. So something is wrong there. Then I think that another pressure from public saying that there is some political reason, and all this discontent, it's actually had good results, because at the end of the day, we started to discuss it with doctors, we started to discuss it with some researchers, international experts, and now we are not reporting pneumonia and COVID-19 separately. We actually combined it. And but traditionally we have very strong civil society, and I think it's also its achievement.
Right. Yeah. On Kazakhstan, though, Darkhan, so the decision behind reporting about pneumonia cases starting from August 1st, how the authorities explained that, why they have decided to report this? I mean, do they accept that the way they were handling this before was a mistake?
So we haven't heard any proper explanation to that. They just said it's just we are following the WHO's recommendations, and that's it. No explanation. And the journalists, were asking this question to our new health minister, and he's excellent at evading from questions, and we didn't hear anything.
And also, we need to be wrapping up the discussion, I guess, very soon. So some of the final points. Tilak, maybe to start with you, Central Asia has been planning their response based on these data, which you guys have been discussing, is based on flawed calculation. They have been taking measures, preventive measures, to stop the COVID-19 based on that data. So what kind of flawed decisions it has been leading to?
I think that Kyrgyzstan now has one of the biggest number of deaths and who infected with coronavirus. I agree with Gulnura that our civil society is one of the strongest in the region. And it was one time when maybe half of government staff was also infected, and our civil society take responsibility for the situation in our country. And our civil society tried to find some decisions how to stop coronavirus. And one of them that like our civil societies tried to tell to our government what to do. For example, we show to our government that we should install centralized oxygen systems in all hospitals to prepare to the second flow in autumn and in winter. And our civil society also asked to our government to make less bureaucracy in registering and in import some medicine or equipment from abroad. So, and now, I can't say that our government also understand what to do to prepare to the second flow. I don't know. We have a lot of risks now. And I'm afraid that in autumn and in winter, we will have a very dramatic situation. Because now in summer it was easier because it was hot, it was warm, and in winter we will have extra problems with heating our houses because we have harsh climate in Kyrgyzstan. It could be minus 30 in winter, and because of very hard, very difficult now economical situation, we don't have a lot of millions of our people now don't have their traditionally sources of they don't have now work. And they don't have their salaries, and it could be a humanitarian problem in autumn.
Yeah, definitely.
So, I can say that we have now two problems. Generally, it's a political crisis and the economical crisis. And in autumn and the winter, we can have a humanitarian crisis. Generally, we have, for example, a record in very high rate of our debt. So it wasn't in our history that our debt more than 60% from our GDP. We have a lot of problems in our economy. Our government now try to take more taxes from business, but business have more problems than ever.
Right. Challenging times ahead. Thank you very much, Tilak. You also mentioned the possibility of second wave. Whomever we talk about COVID-19 in Central Asia, always they say that they are not even yet in the peak of first wave. So, and the authorities are already manipulating with data. So it's unclear how they are going to come out of this situation. But once they do, they have whole set of new challenges to deal with on the economic and social fronts. And these fronts always have had political consequences, especially in countries like Kyrgyzstan. But we need to really wrap up the discussion here with very final points. So it's been already a couple of months since Central Asia is dealing with this situation. Are they learning any lesson on the way they were dealing with this? Do you get the sense of they are trying to do things differently or giving a second thought on things that aren't working? Let's start, Gulnora, with you.
Yeah, I think that the most important is that the government started to understand that open communication is also one of the tactics to combat pandemic, because it very much depends on the behaviors of people, right? So it's not only a healthcare problem, it's a problem of communications and a problem of changing behaviors. So, and now they started to understand it, and I've got information that the government created the whole informational headquarters with 40 press secretaries, and they will be they're actually getting ready for the, let's say, second wave or how we call it, yeah. So, yeah, one of these lessons learned. The other one is that, that in our system, the protocols and medicines and everything were not discussed openly before pandemic at all. So, and there was no involvement of researchers, scientists, and people, and actually doctors in this discussion. It was like, that the government deciding how to treat people. But it's not Ministry of Health. It's somewhere in the PM office. So, and I think that today we started to understand it. And the most important lesson is that I think that our country started to understand that there is a need for huge healthcare reform now. And this discussion is very important, and it's already started.
Yeah, okay. Terrific. And also very quickly from other speakers, maybe Darkhan, we're talking about the lessons learned. And Tilek was talking about, very rightly, about the possibility of second wave during the winter, which could be even more kind of fatal. So any lessons that authorities in Kazakhstan are learning? It's been already a couple of months since they are dealing with this.
I don't know what they are learning, but I know one thing they should learn from the pandemic. So they should learn that the right communication to the people is very important, because despite the efforts of the government to persuade people to follow the rules, to keep the distance, to stay at home, the conservative regions, they didn't follow. They kept celebrating the weddings and doing other celebrations. And if people died from COVID-19, they would gather without just worrying for being infected. And that situation exacerbated the pandemic a lot. But we, the journalism community, the civil society, would help a lot to the government if they were honest with us, with people, with figures and other stuff. But now, since our government is manipulating with statistics, trying to hide, avoiding admitting wrongdoings, so all we are focused is we are forcing our government to tell the truth. We are calculating, we are working on the numbers. I mean, we are putting so much effort and energy to disprove the mispronunciation or misstatements from the government. And if they were honest from the very beginning, we wouldn't just focus on statistics and other stuff. We would join the government to persuade, to work with the people, to inform them that the pandemic is so serious. But now, when we try to persuade people, they would say, look, they say the pandemic is serious, but they're just firing the firework in order to celebrate Nazarbayev's birthday. Look, you are saying this, but the government is doing this. And just we can't say anything to the people. At some point you would think that they're right not to follow the government rules because the government is not being honest with them. That's it.
Good thoughts. Thank you very much, Darkhan. And also, we have been talking about this pandemic throughout the world. In many cases, what emerged to be one of the problem is the message. I mean, you guys were talking about people don't trust what the authorities are saying, and this has been the case in many other places. What I'm trying to say is, maybe the president is not the right person to convey this message to people. Maybe there has to be other ways. There has to be other messengers that they can convey, and their voices are respected. So, Bruce, let me put the question to you in this way. So what happened, so happened. Of course, it shouldn't be that easy to say that, describe the situation. But going forward, what are 2-3 things that authorities can do to fix this?
I understand that the governments have to worry about the economy, the harvest right now. There's all kinds of things like that. But they're way too quick. They've been way too quick to ease the restrictions. I mean, things get really bad. They put a bunch of restrictions in, and they want to get past it, and they want people to get the idea that they're past it and go back to work and get out more and stuff. But this just hasn't worked. Every time they ease the restrictions, the numbers go up, and they failed. So I would say the one lesson they should have learned is that, all of them have come up with some system. If the percentage of cases is this much, then we can't let people out. If it goes below that number, then we can. But this just doesn't have to work. It hasn't worked so far. And so I would hope that going forward, we all want the restrictions to be eased. We all want to be able to get out and get back to our lives as normal and stuff. But you're going to have to do this much more cautiously than they have been so far. To explain to people very clearly why this is true. And I know it's not just Central Asia. I mean, they've had this kind of discussions all over in countries all over the world. But, like I said, no one wants to stick it. No one wants to hang around inside. But every time that people go out and start spreading this, it makes it that much longer until we're going to get back to normal.
Right. I think with this, I'm going to conclude the discussion. Did I miss anyone? like final thoughts? Tilak, any final thoughts from you?
I can say that this pandemic is shows us all our problems in our country and in just management with country. Show us that we have deep crisis in healthcare system.
Right.
It also shows us that because of that, for example, we in our budget just about 4 billion songs. It's about maybe $50 million is going just to healthcare. If we'll compare with another spheres, it's maybe 5-6 times less. I mean that before that, we don't focus on our healthcare system. And it shows us that we should prioritize what is more important for us, for our society. Should we focus on some maybe police or some, what is traditionally for our post-Soviet countries, that they give more money to all this bureaucracy system, to give the salaries to some people. For example, our government had international community gave about $500 million to our government, and all this money goes to salaries in some ministries, in some departments, and it was very inefficient way to manage this money.
Tilak, unfortunately, we have to leave it there. I understand your point. I guess our audience will understand your point. You said the healthcare system has to be priority going forward in Kyrgyzstan. Thank you very much. It was great to have you, Tilak Tokhtugaziev, a social entrepreneur based in Bishkek, Kyrgyzstan. Also from Kyrgyzstan, Gulnara Turalieva, CEO of Data Lab. It's a consulting firm on data. Darkhan Omirbekov, RFRL's Kazakh Service Digital Editor in Kazakhstan, and Bruce Pannier, the editor of RFRL's Central Asia blog, Kishlok Owazi. Thank you, colleagues, for your time and thoughts today.
Thank you.
Thank you.
Thank you. And thank you. This is it from me, Mohammed Tahir, Radio Free Pretty Liberties Media Manager and host of the Majlis podcast here in Washington, D.C. Until next week. Bye-bye.